This is the first presentation for radiological anatomy of the brain, prepared by Prof. Sharaf and revised by Prof. Rami Edward. You remember this appearance that we have cerebral hemispheres, cerebellar hemispheres, and we have the diencephaly, which is formed of the thalamus and hypothalamus, and tract reaching to the posterior pituitary. And we have the brain stem, which is formed of midbrain, pons, and medulla. We have three white matter tracts. White matter tracts and fibers that is sheathed with myelin. We have the association fibers, the commissural fibers, and the projection fibers. Association fibers is the best example is the U-shaped arcuate fibers between gyri and the longitudinal fasciculi between lobes of the same hemisphere. So the association fibers are there within the hemisphere, connecting parts of the same hemisphere, either the arcuate fibers, U-shaped arcuate fibers between gyri, or the fasciculi between lobes. Commissural fibers that's connecting two hemispheres, and the best example is the corpus callosum. But don't forget that there is anteriorly what we call anterior commissural fibers. Projection fibers that are the fibers coming out of the brain, so forming the internal capsule and then forming the corticospinal tracts. We will start with some of the anatomical landmarks. So what is this one? It is the inferior concha. What is this? It is the maxillary sinus. This is the mandibular head. This one is the mandibular head. Inferior concha, maxillary sinus, mandibular head. Masseter muscle, parotid gland, spinal cord, occipital bone. Going a little bit up, we will find the small nasolacrimal duct, this one and that one. Nasolacrimal duct. We have the nasal septum. We have the mandibular head. This is the basi-occiput. This is the region of the medulla. Cerebellar hemispheres. Region of sigmoid sinus. Mastoid hair cells, internal auditory canal, internal carotid canal, and foramen ovale. Posterior, this is the foramen ovale. And this is the external auditory meatus. External auditory meatus is usually opposite the internal one. Now this is the internal auditory canals, and this is the mastoid hair cells, petrous apex, Eustachian canal, region of medulla oblongata, region of the external occipital protuberance. This one is the fourth ventricle, and this one is the greater wing of sphenoid, and this one is the foramen rotundum. Foramen rotundum. Foramen rotundum. And this is the nasal bone. A more higher level, we show the orbit, the optic canals with the optic nerves, the sphenoid sinus, temporal lobes, external auditory canal, and as we said, it is opposite the internal auditory canal here. And these are the mastoid air cells, and F stands for the cerebellar hemisphere. This level is showing foramen magnum, spinal cord, region of the nasopharynx, lateral wall of nasopharynx, posterior wall of nasopharynx, maxillary sinus, and of course this is the mandible, a cut within the ramus of the mandible, here and there. In this level, we should know well about the region of the medulla and the sigmoid sinus. So the sigmoid sinus is the one oblique here, and the medulla is there. Medulla level. This level is showing again the medulla, the basilar artery, the clivus, carotid artery here and there, running in their canals, cerebellar tonsils, sigmoid sinus, mastoid air cells, maxillary sinus, nasal septum, and inferior concha, middle concha. Of course, this is the posterior aspect of the ethmoid sinuses and sphenoid sinus, the orbital cavities, the optic nerve, the temporal lobes, basilar artery, region of the medulla, internal auditory canal, external auditory canal, mastoid air cells, and region of the fourth ventricle. So what is this? Occipital bone, this is the clivus, and this is the jugular foramen. So you have jugular foramen, clivus, and occipital bone. So what this is a mandibular condyle, mastoid air cells, foramen magnum, and here we have suture, vitreous apex, internal canal, and there should be opposite to it here the external canal, but this is variable according to the angulation of the head, and this is the mastoid air cells. Internal canals, greater wing of sphenoid, superior orbital fissure. Carotid canal and basal foramina, You have here the foramen rotundum, this one, foramen rotundum, and you have here the carotid canal. Reaching to the carotid foramen. Of course, this is the external auditory canal going into the middle canal, middle ear, and this is a mastoid person. What is this? This is the clivus, and this is the level of the foramen magnum level, and this is the clivus. Clivus is the main part of the basic occiput. Now these are the vitreous parts of the temporal bone. The temporal bones has thin squamous component and thick vitreous component, and this contains the middle ear cavity inside with the inner ear structure. Middle ear cavity and the inner ear structures are within this area, which is called the vitreous bone, and this is the vitreous apex, and this is the squamous part of the temporal bone. So the temporal bone has a squamous part, vitreous part, and don't forget the styloid process and mastoid parts. So mastoid, vitreous, squamous, and styloid process. Thank you.